Larissa Jacobson. I'm one of the marketing managers with Surgical Review Corporation, more commonly known as SRC. SRC is an internationally recognized United States-based nonprofit patient safety organization. Our goal is to accredit the leading physicians and hospitals around the globe that are excelling in patient care and safety. SRC was founded in 2003 and really came about because there was a need for more consistency in quality care in the bariatric surgery field. We found that this need to increase patient outcomes and have a higher standard of care was necessary, so we began with our first accreditation program in metabolic and bariatric surgery, and after 20 years have expanded to more than 30 different specialty programs. I'm pleased to have with me today Dr. Tamer Said Salama, who is an SRC-accredited master surgeon in both minimally invasive surgery and metabolic and bariatric surgery. He is also dually accredited in both of those accreditations as a surgeon of excellence with Saudi German Hospital in Dubai. I would like to just get a little bit of background information about what inspired you to pursue medicine, as well as how you ended up going into bariatric and minimally invasive surgery specifically.
First of all, I would like to thank you, Larissa, so much for your great introduction and for your beautiful word which you said about me. And let me tell you that I'm really thanks SRC for the great support and the great cooperation for more than 5 years ago. Actually, my introducing to the medical field has a long history. I was born and grew up in a medical family. My father was a professor of neurology, and my same for my mother. So I was born and grew up on how is the patient life change when they become cure after certain disease or after certain medicine. What is the happiness you feel when you see this happiness in the patient field? So it was one of my dream to enter this field and to become a surgeon at a certain moment or at a certain step in my life. Actually, I would like to say a small introduction about myself. I'm Dr. Tamer Said Salama, as you said, Dr. Tamer Salama. I'm a professor of general and laparoscopic and bariatric surgery in Shams University, which is one of the biggest universities in the Middle East. I'm working in the university for more than 20 years almost now. I'm a member of in the IFSO, or International Federation of Obesity and Related Disease, since 2015. I'm a member in the American Society of Surgeon for since 2014, and same for European Society for Laparoscopic and Endoscopic Surgery. As I said, I was proud of to be a member or a master of bariatric surgeon since 2020. Same for minimal invasive surgery. I was a leading professor or leading surgeon to construct three center of excellence, two for bariatric and metabolic surgery in two different hospitals. One of them is Saudi German Hospital, and finally for Center of Excellence for Minimal Invasive Surgery in Saudi German Hospital in Dubai, in United Emirates. Yeah.
That is amazing. So along with that, why did you choose to pursue not only the Master Surgeon accreditation, but the Center of Excellence? So how did you come to find SRC's accreditation, and what really sparked the interest in that?
Yeah, Larissa, let me tell you something. Since I started my private career, maybe in 2010 or something like this, I was looking for, as you said, I have a arranged or stepwise way of thinking. So since I started, I was looking for a system which can give me the best result or support me to give my patient the best outcome. So when as you said, when SRC start, my relation with them start with around 2015, it was a great chance to put this clinical pathway, to put this way of thinking or way of arrangement. Yani, I believe that SRC certificate is not a certificate. It's a high quality environment for a patient healthcare safety. It's not a certificate, you know. So it's an environment which I believe if any surgeon or any physician need to reach a certain level of success, or any healthcare organization, they should go through this pathway or this arranged, stepped way of thinking.
Yes, excellent. I love that because we at SRC also consider it not just, it's not a stamp of approval, it's not a gold star. It really is accrediting individuals who are fostering a culture of excellence. Like you said, it's an entire environment for the patient. It's a living, breathing thing. It's not just another beautiful plaque on the wall, right?
Yeah.
So on that, how has SRC accreditation and going through this step process of quality, how has it impacted your practice and your approach to patient care?
See, as I told you, SRC is providing me or support me to have a clinical pathway, okay, which is to ensure that the patient outcome or patient to ensure us to give the patient the best healthcare service we can do and the best safety. This is through a multiple process. Like for one of them, volume or a number of the patient which we have, and ensure about our result, ensure about multiple hospital inspection to see the quality of our instrument, to see the quality of our theaters, to see the expertise of the team. Another important point, which really I like them, the continuous support for educational point, especially for my staff, my team, as regard the nurse, as regard the assistant. The continuous educational support is very important because by the end of the day, this is a full system which allow us to give the patient a maximum healthcare service we can do, or an excellent healthcare service which can do.
I love that, and I love that you hit on the team because a big part of accreditation and some of our core foundation is not just accrediting the surgeon in the hospital, but it's truly a team effort, right? It's a multidisciplinary team, and we're looking at that entire patient journey from the time they make that consultation appointment to the pre-operation, to during, to the post-operation.
This is the secret. Let me tell you something, Lester. This is the secret that you are not concerning only with the surgeon. You are concerning with the fine details. You are concerning with the surgeon, with his team, with his assistant, with his nurse, with the hospital facilities, in everything. You have a check or you have an inspection for the quality of the instrument which I use. You understand me? You have even you start to do some educational session for our patients. You understand me? So
Mhm.
again, this is a full environmental healthcare service. It's not about a surgeon. It's not about a hospital. You are taking for the benefit of a full healthcare service.
Yes, and it truly is that because patient care doesn't just happen in a vacuum, right? It's an expansive experience. So I love that you are highlighting your team and the importance of having that and how accreditation is looking at that in a collective sense. So how has specifically, so we focus on excellence in patient care and patient safety, and like you said, the outcomes. Are there any specific impact to patient safety that you've seen through accreditation? Like, have you changed any practices? Have through the support from our SRC clinical team that inspects?
Sure, yeah, said this is what all of what we said is have a very good impact in the patient safety, starting from the insurance of the quality of the instrument and quality of the hostel and quality of in the whole environment in the hostel, the education of our team, how to deal with the patient, how to give them the best care, even in monitoring of the patient outcome is very important because this is one of the points which will make a discussion. Yani, if we have a deviation from the normal result at a certain moment, we have a meeting, multiple meeting with a lot of expert team in the SRC to discuss why you are deviating from the normal result. Okay,
Mhm.
so this will help us or support us to get back to what's wrong happened or what how to improve it or how to get back to the best result. So all of this طبعا given surely it go back to the patient safety and go back to the patient benefit surely true.
Excellent. What benefits do you see that other providers might get from SRC accreditation as well? So I know that you've talked about some, but others that you are aware of in the field that have also undergone accreditation, have you seen benefits come out of that in increased quality care?
You are speaking about healthcare providers mainly.
Yeah,
See, I
yeah.
believe that in 2024, I believe that again, this is SRC is a normal way of thinking. I don't believe that there is any healthcare provider or organization or someone who need to reach the top in his result or outcome, and he still didn't use this way of thinking. Again, this is a way of arrangement, how to arrange your mind, how yani it's again in 2024, this is not a time to just struggle or just to create a way of thinking. No, this is a pathway. Since the patient enters the hospital, we know every step he is going to do until he go safely to his home. So it's a way of full pathway of thinking. You understand me?
Mhm.
This is what you provide, or this is what SRC provide for the physician or the surgeon, okay? To prepare himself or to prepare the facility for every occasion or anything which can happen with the patient. You understand me? And by the way, let me tell you something. When the patient feel that there is a pathway, certain pathway he can go, and the whole team know every step, خلاص, this is give him a great confidence and a great feeling that he's in a safe hand or with a safe expert team, which is not just create a step before step. No, this is not the way of thinking. Even if you know this in the accreditation, that's why I always said the first accreditation is the most difficult one. Then the other come when you become expert in the way of accreditation, it become much more easier. If you remember, before the first accreditation, we have a discussion about fine details like a laboratory investigation. You have a look for what's your protocol in your radiology department in case of complication, in case of preoperative. All of this is a very fine details.
And have you seen patient impact since having accreditation? Have you seen higher satisfaction? Have you seen, you talked about the increased confidence. I can imagine, any surgery is scary to a patient, right?
Sure. I see a great difference. It's not my first center of reference, so I see a great difference as regard the result, as regard the outcome, as regard our ability to face again any unexpected or any accidentally occasion like a complication, like something. We are fully prepared to put a full vision or a full plan for our patients. So the patient satisfaction is really high. The results are really good, impressed after this way of preparation or this way of thinking. Sure, it have a very good impact.
Dr. Salama, so what does it mean to you to be a master surgeon? What kind of pride or ownership comes with that?
Let me tell you a secret, Roberta. When I hear about SRC and how many of my popular and famous colleagues all over the world become a master of surgeon or they do a center of excellence, it was a dream for me to be a master of excellence or to do a center of excellence. And to be honest with you, in the first, I remember this very well in 2015 when I start to have a look what is the steps and what we can do to become either a master surgeon or to do center of excellence. It was like a very long road, and it was very difficult to do all of these steps. But let me tell you something. I almost said that, for example, it is like a running ball. Once you put your leg or your mind in this running ball, you will run faster than you imagine. You will just go with this stream. Again, Yarasa, it's a way of thinking. The first accreditation I got from SRC, it was difficult. Yeah, it was difficult. But once I do it, the following accreditation, whatever center of excellence, whatever master surgeon in any specialty I have, it was like very simple because خلاص, this is my way of thinking. This is my way. When I start to work in a certain hospital, this is how I prepare myself. So after a certain time, like 1 year or something, when I plan to do a center of excellence, I don't suffer because I already prepared myself in everything. This is my way of thinking. This is my way of treating the patient, wherever I'm going to be accredited or not to be accredited.
Hi.
So nowadays, after 5 years of this experience with SRC, definitely, yeah, you will struggle or bit difficult in the beginning, but once you prepare your mind and you prepare your approach, medical approach for the patient, you will go through the stream and it will be a piece of nut to do, not one center of excellence, no, two and three, and you can. I'm supporting my colleagues who need to do a center of excellence in different specialty which maybe I'm not involved in this specialty, or I don't have an expert in the specialty itself, but I'm expert in how to do a center of excellence or how to approach the patient in this way.
Excellent, excellent. So I completely agree that, once we really, it's hard in the beginning, but once we change our mindset, then we have sort of shifted and everything kind of falls into place after that. So that's really amazing that you are helping your other colleagues, even out of specialities that you are not currently operating within, to become a center of. That just really goes to how much you truly believe this impacts the patients and the importance of this.
Let me tell you something. I believe this is one of my role in the life, or one of my role as a master surgeon. The point is not only for my patient. As a master surgeon or as a center of excellence or a surgeon of excellence, um, I believe this. I should spread this way of thinking, or this type, or this level of high quality patient care and high quality safety for the patient in different specialty. This is our role as a professors and our as a master. So this is the true role here, Alice.
Yes, we are all working collectively to actually like raise the bar on healthcare standards so that if the bar comes up, patients are getting the quality care that they need, regardless of what type of care that they need. So I love that. Speaking of quality care, we obviously spend a lot of time looking over surgical expertise and things like that. And I know that you are doing some exciting and innovative techniques, offering minimally invasive techniques. Can you tell me a little bit about what minimally invasive for a patient might mean, as well as some of those innovative techniques and technologies that you're utilizing with your patients?
See, as you know, طبعا minimal invasive mean that the minimal access to the patient with minimal scars, okay, with the best or least recovery time with the best result. This is what we mean by minimal invasive, which is always this is the most used technique nowadays. And it's very rare to have an open surgery. Minimal invasive has a little bit wide variety, starting from laparoscopic surgery till robotic surgery.
Mhm.
طبعا I'm proud to be one of the earliest surgeon in my area to use the most advanced technique in different ways. For example, I'm one of the first who used electric or automatic stapler in the bariatric surgery. This was around 2017. يعني I use it once. Once. I'm the first one use it in the one of the first طبعا يعني sure يعني to use this type of stapler. First, it gives my patient again the concept of SRC. It gives my patient the maximum safety. Okay. Second, it's give me the most or the best outcome result, which is always our target. So again, any innovation technique or any innovation instrument which give me maximum safety and maximum best outcome, you will find me always searching for it, and you will find me using it. I have a concept, Yalarsa, which is very important to me. I believe this. My patient deserves the best. So whatever I'm going to find, I'm going to use it.
I love that. So it is not only are you teaching others, you are continually learning as well and adopting
Thank you
those
so
new
much.
technologies. I love this. I'm a big fan of we are always learning and growing. What are some of the services that you offer within minimally invasive as well as bariatric surgery options?
Definitely, I'm a laparoscopic and general and pediatric surgeon, minimal invasive surgery. We offer all of the laparoscopic or minimal invasive GIT service like hernia repair, lap colectomies, lap uh, uh, I have a very special interest, and I have a very nice center of excellence here in Saudi German Hospital about esophageal surgery, especially anti-reflux surgery. We have a very fantastic result in this type of surgery, anti-reflux, Nissen, and its modification surgeries. Okay, so all of laparoscopic and minimal invasive procedure, I have a good experience in it. In the past 5 years, we did around 3,500 cases almost in different type of laparoscopic surgery. يعني it's ranging from bariatric by all its mean, like sleeve bypass, we do surgery, metabolic surgery for diabetes cure. As I told you, esophageal surgeries, anti-reflux, inhalers, hernia types, hernia repairs, all of type of hernia repair, cholecystectomies. So it was, I believe it was laparoscopectomies, liver cyst or liver excision. So I believe that we have very good experience in laparoscopic surgery, in addition to a general surgery, which is still I'm a general surgeon. We're still doing thyroidectomies. We're doing. I'm one of, I believe, an leading surgeon in the ultrasound guided treatment for hemorrhoidectomy or hemorrhoidal ligation. This is my area of interest, or this is what we can offer in our center.
Excellent. So a whole kind of spectrum there, with the general surgery to hernia and minimally invasive, as well as the bariatric specific. I thought that.
Almost we said that the general surgery is the spot which we start to be,
Yeah.
It's like
It's like the entry of the specialties, right?
yeah, I agree with you.
So what benefits can patients expect by choosing you versus another provider who is not accredited? What are
See, I'll tell you something. Away from the what we said before, that you ensure the best patient outcome result and the patient safety. I believe that you support patient in very important point. First point, post-operative education, which you have a very nice team to support them at regard the surgery, possible complication, and follow-up, nutritional education. Yeah, you have a very nice supportive educational team. Second point, which is very important, within this huge world nowadays, it's when a patient comes and he decides to do a certain surgery, he start to search for the best center of excellence or the best team who can do the surgery, the best result, the best outcome. And actually, this take too much from the patient and need a lot of effort. You cut all of this and you just give it to him on, we always said, in a golden plate. Yeah, this is a you give him the latest information by center of excellence, the best center of excellence in his area or in his country, and the best leading team, and their outcome, and you ensure him that this team using certain instrument, that this team has a certain volume of case, that this team has an expertise in your case. So definitely it's very important, because you cut a very long way for the patient. I believe this is a very important point, and this is very important support from the patient to the SRC firstly. That's why nowadays I believe I start to hear from a lot of patients that when they seek for a certain surgery in certain areas, they start to search through the SRC. This is a way of trustability, and this is a way of credibility. Sure, yeah.
Absolutely. Well, thank you so much, for telling us a little bit about your background, as well as the importance of accreditation. I love that your patient care philosophy is all encompassing. Like you said, it's not just the surgery, it's the entire environment. It's the after, when the patient goes home, and the additional supports. It's the pre-work before they even come through the doors, and the importance of having accreditation as a way to find a credible provider in your area.
Very nice to meet intelligent person like you, and I'm really proud of my cooperation with SRC for more than 5 years. And again, I believe this is my role as a physician, as a human being, as a surgeon, as a master of surgeon. This put a responsibility to me to spread this way of thinking, to ensure our patient safety, and to give the maximum and the best outcome and result for our patients.